Obviously, for a decade, we've been focused on becoming the best at treating ED and low T. But we hear it every day. As urologist, Dr. Smith, I know we've talked about how much you hear it. Guys are always saying, how can I make my penis bigger? And now we're answering that question with MensPro Max and Penile Girth Enhancement.
Yeah, it's nice to have an answer for those patients. So we're talking about penile girth enhancement. So we're talking about making the actual width and girth of the penis bigger. We're using a substance called hyaluronic acid. Hyaluronic acid is a naturally occurring chemical within the body. It makes up the extracellular matrix and is composed of a lot of sugars. But the effect of it is that it actually bulks up tissue. So think of a lip filler. Think of a cheek filler in the aesthetic world. Think of the older patient who might have knee problems that gets an injection of something to help build cartilage and lubricate the knee to fill that space. We're using that same medication that's FDA approved in the face to put it into the penis to increase the girth. It's a very safe compound. It's an instantly appearing compound so that it's evident exactly what's going on, and we have an instant result with customizable results depending on what we're looking for.
Wow, so instant results. How much bigger can we expect the penis to get?
Yeah, all penises are different. So some have more length, some have more girth, and so it's a little bit customizable patient to patient, but you can decide how much you're going to put in based on the result that you're looking at, and it's a real-time decision. So when I'm in a room with a patient, the idea is if we've reached the goal of what we're looking for, we'll be able to see that result and be able to stop at that point or say, no, I think I want to go a little more.
And what if the patient doesn't like the way it looks?
Certainly, that can happen. So the wonderful thing about hyaluronic acid is it actually has an antidote or a reversal, if you will. Hyaluronidase is an enzyme that breaks down hyaluronic acid. So let's say you get a result that has a bump or it's asymmetrical and they're not happy with it. All it requires is an injection of that enzyme, the hyaluronidase, to completely dissolve and remove that so that you can then start again from scratch.
And then after that initial procedure, how long do the effects last? Will they need more filler after?
Everybody has a different response to the amount of time that it lasts. The average is about 12 months. Sometimes it can last about 2 years. Now during that time you may lose a little bit of girth, and so some touch-ups are necessary depending on how each patient goes, but it could last up to a year or two.
And then what about aftercare? Once the procedure is done, what do you do afterwards?
So in real time when we're injecting it, I'm going to do some molding and modeling of the penis afterwards to make sure everything's even, make sure it has a good aesthetic appeal, and that we're happy with the result. I'll teach the patients how to do that at the end of the procedure so that they can do it at home for the next 7 days. During that time, the filler is actually starting to solidify. It's starting to become more natural feeling as opposed to when it's first put in. And I got to tell you, Evan, this is very natural feeling. The first time I saw a patient that had this done, I was blown away because I had no idea. It looked like a normal girth. It was large, it was girthy, and would have never thought that would have been something that had been operated on, but it had this procedure.
Man, that's amazing.
Yeah.
And then in terms of going back to having sex, sexual intercourse, is it going to take? How long is it going to take me to jump back in?
Yeah, we definitely have to take a little bit of a pause from sex after this is done. So 7 to 10 days is typically what's recommended. The idea being that you don't want to disrupt the fluidity of what we're trying to get to form. So it can 7 to 10 days. After that, it should be everything all clear.
Gotcha. And how long does the actual procedure take?
Probably start to finish from patient getting in, being counseled, probably an hour. It's only about 20 minutes of procedure time, but wow. As far as cleaning and modeling and all of that, an hour.
What about side effects? What are the potentials there?
Anytime we're doing injections into skin, a clean area, there's always a risk for infection. There's a mild risk of discomfort, but I do a numbing block of the area before to mitigate as much discomfort as possible, and most patients tolerate this very well. Really the only other downside is that you may not be happy with the result, and as we've already discussed, we simply reverse it if it's not what you're looking for.
Right, reverse it and try again.
Exactly.
That's amazing.
The great thing about hyaluronic acid is it's safe and it's naturally occurring, so it can be used in other areas of the body like it has already been for the face. So in the areas of men's health, and specifically with urology, there are studies that demonstrate that not only is it safe to use hyaluronic acid in the penis for girth, it's also safe to use it for issues like premature ejaculation, issues like Peyronie's disease, which is a curvature of the penis. Both of those things it's been demonstrated to be effective with them, and I think that it would be a good application of this.
That's incredible. What do you think about this procedure for Peyronie's versus, say, acoustic sound wave therapy?
There's better data on this than there is with acoustic sound wave therapy.
Really? No kidding. Okay, cool. And then in terms of how often you can get this done, some guys come back, they're like, well, I actually want it a little bit bigger.
Mm-hmm.
I like what you did, it looks good, but now I just want it a little bit bigger. Or maybe I want to go after some of that premature ejaculation. How often is reasonable for them to come back if they want more?
Oftentimes after the initial visit, coming back in a week or two just to have a face-to-face to say, how are things going? Are you happy with it? Before we kind of go back to having sex, we're looking at just the actual look of the penis. Does it look okay? Does it feel okay? And we could even add more at that time. Some people prefer to have touch-ups done if they start to lose some over time, and that can be done as needed.
What about partners?
Certainly. So the idea with girth enhancement is that you're better able to have a more pressure on certain points in the vagina, which actually makes for a better sexual experience.